organophosphorus chemical nerve agent and insecticide poisoning and DuoDote autoinjector, atropine and pralidoxime chloride injection, mechanism of action. DuoDote, a combination of atropine, a cholinergic muscarinic antagonist, and pralidoxime chloride, a cholinesterase reactivator, is indicated for the treatment of poisoning by organophosphorus nerve agents, as well as organophosphorus insecticides in adults and pediatric patients weighing more than 41 kilograms, 90 pounds. To learn more about DuoDote and other Meridian products, please visit meridianmeds.com. The health information contained herein is provided for educational purposes only. All decisions regarding patient care must be made considering the unique characteristics of the patient. Important safety information is available at the end of this video, and full prescribing information can be found at meridianmeds.com. Organophosphorus poisoning can result from exposure to certain types of chemical nerve agents and insecticides. Exposure to chemical nerve agents can happen when they are used in chemical warfare or terrorism. On the other hand, accidental exposure to organophosphorus insecticides can happen during the production, transportation, or application of such insecticides. Despite how a person is initially exposed, organophosphorus chemical nerve agents and organophosphorus insecticides have the same mechanism of action. In addition, the symptoms that result from poisoning manifest similarly. People can begin to experience mild symptoms of poisoning within minutes of exposure. Symptoms can include blurred vision, unexplained teary eyes and runny nose, difficulty breathing, nausea and/or vomiting, and stomach cramps. Severe symptoms may appear within 1 to 10 minutes after significant inhalation exposure, and death can occur within anywhere from 1 minute to 18 hours, depending on the specific poison. As soon as symptoms of organophosphorus poisoning are identified, treatment should be administered immediately. Warnings and precautions include cardiovascular CV risks, tachycardia, palpitations, premature ventricular contractions, flutter, fibrillation, etc. Use caution in patients with known CV disease or conduction problems. Heat injury may inhibit sweating and lead to hyperthermia. Avoid excessive exercising in heat exposure. Acute glaucoma may precipitate in susceptible individuals. Urinary retention. Administer with caution in patient with bladder outflow obstruction. Pyloric stenosis may convert into complete obstruction. Exacerbation of chronic lung disease. Atropine may cause inspiration of bronchial secretions and formation of dangerous viscid plugs in individuals with chronic lung disease. Monitor respiratory status. Only administer DuoDote to patients experiencing symptoms of organophosphorus poisoning in a situation where exposure is known or suspected. 3 DuoDote autoinjectors should be available for use in each patient, including healthcare providers, at risk for organophosphorus poisoning. 1 for mild symptoms, plus 2 more for severe symptoms. Let's take a look at what happens inside the human body during normal cholinergic nerve functioning and how that changes when organophosphorus chemical nerve agent or insecticide poisoning occurs. Cholinergic nerves are located in the autonomic nervous system, which controls tear and mucosal secretions, heart rate, breathing, and gastrointestinal muscles, and where nerve endings are attached to skeletal muscles, also known as neuromuscular junctions. Cholinergic nerves are also part of the central nervous system and can be found inside the brain. As an example, let's have a look at a cholinergic synapse, where acetylcholine acts as a neurotransmitter. When it receives the proper signal, acetylcholine is released from the axon terminal of the presynaptic neuron and enters the gap called the synaptic cleft. As the acetylcholine reaches the postsynaptic neuron, it interacts with different proteins. One of these proteins is the enzyme acetylcholinesterase, which catalyzes or accelerates a chemical reaction called hydrolysis. Through hydrolysis, the acetylcholine compound is split into fragments, so it is no longer active. The acetylcholine receptor is another protein that acetylcholine can interact with by binding to it. When it binds to the cholinergic receptor, acetylcholine can induce a nerve impulse. There are 2 kinds of cholinergic receptors to which the acetylcholine molecules can bind: muscarinic and nicotinic. Muscarinic receptors on internal organs control things like sweating, salivation, heart rate, and bladder function. Nicotinic receptors on muscles control muscle contraction. Both nicotinic and muscarinic receptors in the brain contribute to cognitive function. Organophosphorus chemical nerve agents and insecticides disturb normal function within the cholinergic synapses and neuromuscular junctions. This occurs when they enter the synaptic clefts and bind with acetylcholinesterase, preventing it from catalyzing the breakdown of acetylcholine. This inhibition causes acetylcholine to build up, producing overstimulation of the nerves, which can result in changes in heart rate, excessive salivation, sweating, tearing, runny nose, breathing difficulties, and loss of bladder and bowel control. Pralidoxime chloride and atropine are two antidotes used to treat organophosphorus insecticide or chemical nerve agent poisoning. DuoDote contains both atropine and pralidoxime chloride in a dual-chamber autoinjector. Pralidoxime reactivates acetylcholinesterase that has been inactivated by organophosphorus poisoning. Reactivated acetylcholinesterase is once again able to hydrolyze or break down acetylcholine to help restore impaired cholinergic nerve function. The most significant effect of pralidoxime is that it helps relieve symptoms caused by excessive activity of nicotinic receptors, such as respiratory muscle paralysis. It also reduces muscular twitching and general weakness. Pralidoxime has a minor role in relieving symptoms from increased activity of muscarinic receptors, such as excess salivation or bronchospasm. Atropine helps relieve airway constriction and secretions, thereby alleviating difficulty breathing. It also relieves bradycardia, nausea, vomiting, stomach cramps, involuntary urination, involuntary defecation, and confusion. Atropine can contribute to decreasing convulsions, but an additional anticonvulsant may be necessary for complete control. Atropine does this by blocking some of the muscarinic cholinergic receptors from being bound and activated by acetylcholine. This helps further reduce the overstimulation of the cholinergic receptors. Atropine blocks only the muscarinic cholinergic receptors, which are located on smooth muscle, cardiac muscle, and secretory glands and on neurons in the central and peripheral nervous system. Pralidoxime chloride and atropine work to restore cholinergic nerve function. Individuals should not rely solely upon agents such as atropine and pralidoxime to provide complete protection from organophosphorus nerve agent and insecticide poisoning. Primary protection against exposure to organophosphorus nerve agents and insecticides is the wearing of protective garments, including masks designed specifically for this use. Evacuation and decontamination procedures should be undertaken as soon as possible. Medical personnel assisting evacuated victims of organophosphorus nerve agent or insecticide poisoning should avoid contaminating themselves by exposure to the victim's clothing. Please keep watching for important safety information on DuoDote. Important safety information. There are no contraindications to the use of DuoDote. Cardiovascular risks include tachycardia, palpitations, premature ventricular contractions, flutter, fibrillation, asystole, and myocardial infarction. Other cardiovascular adverse reactions have also been reported. Use caution in patients with known CV disease or conduction problems. Heat injury may occur. Atropine may inhibit sweating and lead to hypothermia. Avoid excessive exercising and heat exposure. Acute glaucoma may be precipitated in susceptible individuals, and therefore DuoDote should be administered with caution in patients at risk for acute glaucoma. Administer with caution in patients with bladder outflow obstruction, as urinary retention may occur. DuoDote should be administered with caution in patients with partial pyloric stenosis because of the risk of complete pyloric obstruction. Atropine may cause inspiration of bronchial secretions and formation of dangerous viscid plugs and may exacerbate chronic lung disease. Monitor respiratory status. Common adverse reactions of atropine include dryness of the mouth, blurred vision, dry eyes, photophobia, confusion, headache, and dizziness, among others. The common adverse reactions of pralidoxime chloride include changes in vision, dizziness, headache, drowsiness, nausea, tachycardia, increased blood pressure, muscular weakness, dry mouth, emesis, rash, dry skin, hyperventilation, decreased renal function, excitement, manic behavior, and transient elevation of liver enzymes and creatine phosphokinase. Muscle tightness and pain may occur at the injection site. Patients who have received succinylcholine and mivacurium may exhibit an accelerated reversal of the neuromuscular blocking effects when treated with DuoDote. Monitor neuromuscular effects with concomitant administration. Safety and effectiveness of DuoDote in pediatric patients weighing less than or equal to 41 kilograms, 90 pounds, have not been established. Geriatric patients may be more susceptible to the effects of atropine. Pralidoxime chloride can cause decreased renal function. Patients with severe renal impairment may require less frequent doses after the initial dose. Patients with severe hepatic impairment may require less frequent doses after the initial dose. View the full prescribing information for DuoDote at meridianmeds.com. This video is intended to be viewed within the context of its original location online. Pfizer is not responsible for the content if viewed elsewhere. The product information provided in this video is intended only for healthcare professionals in the United States. The products discussed herein may have different product labeling in different countries. If you wish to report an adverse event or product quality complaint, please call 1-800-438-1985. For medical questions concerning Meridian products, to report an adverse event, or to speak to a member of Pfizer U.S. Medical Information, please call 1-800-438-1985. You are encouraged to report side effects of prescription drugs to the FDA. Visit fda.gov/medwatch or call 1-800-FDA-1088. If you have a medical question concerning Meridian products, please call 1-800-438-1985. U.S. HCPs can visit PfizerMedInfo.com. For information about ordering DuoDote or for additional training materials, please call a Meridian representative at 1-800-638-8093 or visit meridianmeds.com.